Are you guys here?
All right.
It's recording,
Looks like we're all here. Cool.
and it says it's live, so it's recording.
Okay.
So, Sarah, you're group leader. Do you want to take the lead here
I'm
and
the
tell us
leader.
what to
Oh,
do?
is it me or Melissa?
Or, I mean, Melissa. Sorry, wrong,
Sorry.
wrong.
I'm like, oh
Confusing
no.
this up.
Is she there or is Jared here?
There she
There we
is.
go.
Hello, sorry.
So
All
now we're
right,
waiting
let's do the
for
work.
Jared.
Mine's not.
There we go. We hear you.
Yep, I can hear him, but just see his little picture.
His picture. There we go. You're
Okay.
up now,
Okay.
Jared.
It was taking forever to load. So
That's okay.
All right, we are live. We'll turn it over to you, Melissa.
To me.
Group leader, just get us going.
Oh, goodness. Okay, so I guess since this is our first meeting, we are going over the lesson preparation assignment, correct?
Yes.
Yeah.
So we've all done the first section, which I believe was the first 5 questions. So do
Yeah.
we want to go over that, or do we want to just continue on to part 2 to work together on that?
I mean, how did you guys do when comparing it to like the answer sheet? Did you feel like you understood it? Did you feel like your answers are close?
Right.
Yeah.
I mean, I thought it was pretty straightforward.
Right.
Yeah, it was pretty self-explanatory, huh?
Yeah, or at
I
least
the
on
only
that part.
the only question I had, probably because my mind doesn't work this way, was just um, the p-value. Just understanding that I understood the concept, but understand what that actually meant when it comes to probability. And I noticed on the, and maybe you guys have a better insight on how probability works, but when you get rid of, or when you're doing the null and the alternate hypothesis, you
Yeah.
get rid of the null if the number is very, very small, and you
Yeah.
keep it. And so I was trying to understand, well, what does that small number actually mean? And I think I figured it out. Like, it means that it's less likely to just be, just by chance. It
Right.
shows that there is a big enough difference. Is that what you guys understand, or?
That's how I understood it, more or less.
Yeah. So basically, p-value, if it's lower, then there is less of a probability or the likelihood of, oh gosh, how do I formulate this in my mind? Somebody help me finish my sentence.
Like a likelihood that it's just chance that the
Right.
results came up or something?
Yeah, I
Yeah.
believe so. And then the higher the p-value or the probability slash likelihood, then yeah, you would. It's the opposite.
Yeah, because in the example that they gave us, with with the vaccine, the polio vaccine,
Right.
they had us
Yeah.
How many
divide,
kids?
right? And it was dividing the number of the people who got polio divided by the total number.
Yeah.
With the vaccine and then with the placebo or whatever. And so I guess that if it was 100%, got the disease, it would have been the number 1, because it would have been 200,000 over 200,000. So the
Right.
further you get away from that, you're getting a smaller and smaller number, I guess.
Yeah.
Uh-huh. That makes
Anyway.
sense. No, yeah, I think that's exactly what they're saying. So, well, I guess if we've got that down, I don't believe there are any more questions on questions 1 through 5. So, moving on to section 2.
Can you
we'll-
have this open while we look at the stuff online or no?
Yeah, you can.
So, like, I can shrink this down while we chat.
I've
Yeah.
got mine open.
Yeah, so I have mine open right now. So
Okay,
I
so
have
I'm
mine
still
plus
there while I'm looking at my.
Yeah.
Okay.
Yep.
Sorry, I'm just trying to figure this out.
Yeah,
No,
no,
you're
you're
fine. I guess we're all still kind of trying to figure this out. So
Yeah.
this is
Right.
the first one. So all right, the first one, number 6, is determine the correct sampling method for each scenario. So we've got, I think there are 4. Are there 4 sampling methods? I gotta get mine.
Yeah.
There's cluster,
Well,
there's
there's
systematic.
actually like 6, but on the
Right.
'cause the convenience and the voluntary, they didn't just are
Yeah.
also 2 more. But
Let me see if I can find where I placed mine.
Yeah,
Whoa.
I'm logging back in to find mine too. I just got logged out.
I feel like I have 50 million windows of
I do
Word
too.
and Safari open, and I'm just all over the
And my
place.
notes and everything. I know I'm trying to find where I was at on this, and okay, so here's
Okay. Oh goodness. Did I exit it? Oh no, here we go. Okay, so let me see where that is.
okay, and I'm trying to find our little hangout because now that I shrunk it down, I don't see it.
you're still here at least. So.
Yeah.
Well, they have the 4 are simple random, so SRS,
Systematic.
systematic, stratified, cluster, and then they said there's convenience and then voluntary response as well. But
Where is voluntary response? Oh, okay.
that was maybe
Yeah, but
somewhere
don't
just
they normally try to avoid voluntary response as much as
Oh, here it
possible?
yeah, that introduces bias.
Exactly.
And they said to avoid convenient sampling as well. Too.
Yes. Okay, so do we want to go over what each one is first, or do we just want to start? Well, I
I
guess
thought that the notes were pretty thorough in the 2 little
Yeah.
video webcam things that he did.
uh-huh.
And I basically wrote them down verbatim as he went through just because I think we're going to be using that a lot.
Yeah, I think you're right. Okay.
I would just go through the questions.
Gotcha.
Let's just do
All
that.
right. So the first one is A medical student researches the prevalence of aspirin usage by questioning all of the patients who enter her clinic for treatment. So how would we go about?
So is this our group quiz?
Yeah,
Yeah, we're just
I'm
answering
not,
the question.
I'm not 100% sure because then we also have to do the quiz.
I think we
Okay.
do the quiz on our own, but this is just homework. I don't know. I'll
Okay,
look
so
that
this
up.
is the group homework we're in. Sorry, I'm just trying to.
No, that's a good question. Honestly, I am not 100% because I talked to a girl who had taken this class last semester, and she had said that they took the quizzes together.
Oh,
So,
Okay, click start. So did you click start?
Yeah, well, it says like right here, it says after you completed the group assignment, click start below to begin the quiz. While you are encouraged to work together on the quiz, each member of the group
yeah,
must submit his or her own answers. So we do it together, but we work together on it, but we all have to submit something.
your separate assignment, your
Okay.
separate.
Okay, so sorry, just so I'm clear, are we in L02 homework assignment and quiz?
Yes.
Okay, I just don't want to click start and get
So
stuck
are
in
we
something
going
and
to the
take a
quiz
0
now,
on it because
or we-
I'm.
but wait, we need to just go over the homework first,
Yeah.
though. The homework
Let's-
questions first.
So the homework attachments, is that what we're talking about?
Yeah,
Part 2, where it says you must fill out this part during your group preparation session.
So let's do that first. I'm like, whoa, hold on.
Sorry, I'm trying to find. Okay, which one we're doing?
Yeah.
Okay.
So
Preparation.
let's go over questions 6 through 9, and then we'll do the quiz
Okay.
together.
Yes,
Perfect.
trying to
Don't want to
figure
get
out
ahead of
which one.
ourselves. Okay. So on the first one, are we ready to continue?
Yeah.
Yes.
Okay.
Part 2, number 6, correct?
Yes, part A.
Thank you. Okay.
So does anyone have any ideas? Medical student usage of aspirin. Let's see. Questioning all of the patients who enter her clinic for treatment.
Now, the question is asking us what they did, not what they should have done.
Well, it
Right.
says determine the
Method.
correct sampling method for each scenario. So
right,
which,
like what sampling method they used in the problem.
I suppose so, yeah.
Yeah, which one we would use.
Yeah.
Oh,
Or we think they would use.
No, because
Yeah.
it's not what we would use because they already did it. It's asking us what they did.
What they did.
Right.
Yeah.
Well,
Okay.
essentially what we think they used.
Yeah, what
Yeah.
sample we think, what style they used. So
Right.
the first one, I thought it was convenient sampling. I thought that they just did as people came in the door. There wasn't any
Yeah.
method to it.
Right.
That's right. That way you get the most random if you just, hey, welcome, and you just do it right then.
Yeah.
Because they gave the example of people just walking into a mall, and that was considered convenient sampling, and I think that that's basically what it is, walking into the clinic.
Support
Sorry.
your PBS station.
Are you watching Survivor? No.
No, I was actually watching Downton Abbey.
My wife loves that show.
It is so addictive. I did not know what all the fuss was about until I started watching, and I thought, wow, that is so just, okay. So I've been
Yeah,
watching that.
It's good. It's
It's been
good.
my break in between classes.
Okay, so I think we all came to a conclusion that yes, convenience sampling would be the answer.
All
Yeah.
right, what about B?
The Colorado.
Colorado Department of Health obtains an alphabetical list of 2 million adult Colorado residents and constructs a pool of survey subjects by selecting every 100th. Oh, system. Is that?
Genetic, or-
Systematic.
Yeah,
That's what I have
systematic.
to do.
I like how I didn't even finish reading. I'm systematic.
It's like once you hear the 2 million and the divide into parts. And
Yeah, exactly. Wait. Okay, so then the next one. In a Gallup poll of 1,059 adults, the interview subjects were selected by using a computer to randomly generate telephone numbers that were then called.
The
Simple
random
random.
one.
Yeah.
Right, SRS. Yeah.
Okay.
And I think on that, whenever you hear random, that's usually your
Yeah.
indicator.
Yep, I would agree with that. Number D, what does that say? A dietitian has partitioned people into age categories of under 18, 18 to 49, 50 to 69, and over 69. She is surveying a simple random sample of 200 members from each category. Is that cluster, maybe?
It's
I said stratified.
Sampling, just because they divided them into groups, and then they did a systematic.
Yeah, because isn't that the cluster? Or let's see.
Stratified. What I
Is it
think.
stratifying?
yeah, you're right. Stratified.
Well, because the definition of stratified is they're grouped according to similarities of like age, and then they take a random sample.
Random is drawn between
Yep.
each of the. Okay, yeah, you're right. You are right. So that one is strata. Oops, sorry. Okay, so the last one, a Johns Hopkins University researcher surveys all cardiac patients in each of 30 randomly selected hospitals.
Yeah, so that'd be the cluster one.
Okay.
Yep, that's what I had.
So the difference between stratified and cluster is they sample everyone in the groups.
Yep.
Not they don't put
So
them in
which one's
similar-
that one?
The cluster?
No. So what was the difference between the two? Because I am noticing that with those two, I
They're very
am getting
similar.
those mixed up. So can somebody explain in a simplified manner as to the difference between the two?
Yeah, I mean, I think it's the difference is that in the stratified, first they categorize them into some kind of groups, age, sex, or some sort of similar qualities that they would be grouped into a group, and then within those categories, then they take a random sample from each, right?
Yeah,
But
that's
then-
fine.
But then
I
the
think-
cluster, they do, they choose maybe a group that someone belongs to. Like in this case, it was the hospital, but then they do everyone in that hospital.
Yes,
Mhm.
I think that's what they do is in the cluster they just grab a cluster. Like there's 6 people there, grab those 6 people. But in the stratified, I think they say, okay, well here's 6 people that are over the age of 60,
Yeah.
so we'll do that.
Right.
Is that what you guys are understanding? Because that's my
Yeah, that's how I'm
Except
seeing.
for the 6 people are clustered in some format, like
which
There's
one?
some organization to it.
Oh, maybe not. It says it's a group of some kind, but it could be
Yeah.
like,
I thought cluster was just a cluster. I thought they just, but maybe I'm not understanding it properly. I thought when they cluster,
they
they
all
just,
live in one city.
I thought that would be stratified,
Yeah, I guess you're right.
but maybe not. Maybe I'm understanding, but I think they find similarities with stratified, like, they're all in the same
Yeah.
city or they all are the same age group.
True.
And cluster, it's just, okay, here's 6. But in
Yeah.
stratified, it's, well, these 6 people live
Okay.
in
So
California.
Yeah. Does that make sense, Melissa?
Mm-hmm. All right.
But
Yeah,
don't listen to me. Who knows? I'm still trying to figure out this computer program.
I'm just rereading the definitions. So I think it's just a matter of memorization and the fact that they are so closely related. I'm going to have to make the distinction in my mind so that there isn't any later confusion. But yeah, that definitely
Real
makes
quick,
sense.
I'm trying to find where you guys get those the definitions. I can't remember where I got them.
On the
It-
video.
Oh,
On
yeah.
the
He has a site through BYU Idaho. It's called Lesson 2: The Statistical Process and Design of Studies of Studies.
Oh,
I
yeah,
think
yeah.
it was a link.
They were those 2 video links that were under individual preparation.
Okay,
Yeah,
cool.
or they were the 2 videos. I'm looking at the website.
And then I'm getting the definitions from the homework where they had the matching.
Uh-huh.
Yeah.
That
Just
too.
so it's in
That's a good
front of me.
idea.
I
Yeah,
printed that paper out, so those definitions are what I'm looking at. But
that's a
Right.
great
That's probably
idea.
easier instead of flipping back and forth.
Right. I just wrote them all down, took billions of notes. I should have probably just printed the homework.
yeah, I printed it and then took notes on it.
All
You
right.
talked about the answer key is what you did?
Oh, yeah, I don't know what. Yeah, just on question 2 of the homework, I'm just just looking at those definitions.
Yeah.
Where we had to match them.
Yeah.
Okay, that's a good idea. Maybe that's what I'll keep with my notes.
Okay.
Just because it's here, that's why I'm using it right now. But
All right.
So
We ready to
next
move
one?
on?
Yeah.
yes.
Okay. So, question 7: the American Medical Association, gosh, I hate that word so much, wanted to determine general patient satisfaction with the patient's primary care physician. Determine the type of sampling method used in the following scenarios. So, another one. A, they take a simple random sample of doctors and then sample all of the patients that the doctor works with.
I think it'd be cluster just because they say random sample of doctors.
Yeah.
Yeah,
I think,
and then all of them. So that's why
All
I
of
said
them.
cluster.
Yeah.
let's say, okay. So anytime random is involved and then you've got several groups,
Yeah.
cluster is involved.
Yes or no, because that could be
Or all.
stratified too.
Unless
but
they
because
say
it's random, it's
yeah.
not.
Unless it's
Anytime
like
they use the
a
word
group-
all, it's cluster.
Yes, that's the key.
Yeah.
Okay.
Because
damn.
stratified, they divide it and they do random sampling, but they do it in similar groups. So
Okay.
I think when it says similar, we have to remember that's stratified.
Okay, gotcha. That's going to be the death of me. Okay. So B, they put all of the residents' names in a computer and use a random number generator to get a sample of 100 patients.
The SRS.
SRS.
Sample random. Okay. Then C, they divide the residents up by gender and then do a simple random sample of residents within each gender. So then is that the
The
Stratus.
Yeah,
whatever.
because there's similarities. Uh-huh.
Yep.
All right. And then finally, they randomly pick key intersections in the city and then picking every 5th person that walks by after randomly picking one of the first 5 people to be in the sample. So that's systematic.
Yeah.
Yeah.
Systematic to me is just like a lot more complex of a sampling. That's
Right.
what I think about it. Is like,
So-
how can you make this the most complicated possible? Okay, that's
Yeah, really.
systematic.
There
and
you
the
go.
interesting part in all these is everything's supposed to be random, but
Yeah.
there's lots of different ways to randomly do it, I guess.
Exactly.
Yeah.
All right. So moving on to question 8.
Okay.
Determine for each scenario whether it is an observational study or an experimental design. If it is an experimental design, determine the response, treatment, and subjects. Oh, for heaven's sakes. Okay. So A, the Center for Disease Control obtains current flu data by randomly polling 300 men and 300 women. So is it observational or experimental?
Observational.
Yeah.
Mm,
Experimental. Sorry, I'm looking at my.
no, you're fine.
Yeah. I would say observational.
Right, because you're not really doing anything. They're just
You're observing what they say.
exactly. It's a poll. So B, I'm assuming is going to be experimental, but we'll read it anyway. You plan to conduct an experiment to test the effectiveness of sleep. What is that?
Sleepies? I don't know.
Sleepy.
Sleepies,
Okay. For a second, I thought, are my eyes okay? Am I reading that right? A new drug that is supposed to reduce insomnia. So you randomly divide 1,000 patients into 2 groups, where half get sleepies and the other a placebo. You record the gender of each subject. You will then observe how many hours of sleep they get in a week. So that's obviously experimental.
Right,
Yep.
because you're applying a treatment.
Uh-huh.
Yeah.
And then we are to determine determine the response, treatment, and subjects. So,
Response.
yeah, I need to remember what the response is.
So is that like the response variable? Is that what?
I
Yeah.
think so.
That's what I'm
Variables of
talking about.
interest is what.
And so wouldn't that be what they do to do the experiment, like giving them the sleepies, or no? Versus a placebo, or is that
I
different?
think the response would be like what happens. So it'd be like the hours that they sleep.
Yeah, it's the variable of interest. So what's of interest right now? What are we trying to
Yeah.
figure out?
The
Oh
hours,
yeah, okay.
How long they sleep.
Oh, so response. I mean that makes sense, response. But I thought, okay, variable.
Uh-huh.
So, but it's actually the result or what they're measuring. Is that what you mean?
Yeah, what's measured?
Measured exactly.
Okay.
What's being tested?
So hours of sleep.
Exactly.
Okay, so what's being tested?
Yeah, what they're interested in. Because in the definition it says variables of interest.
Yeah, that didn't make sense to me until you said what's being tested. So
Exactly. I think they could have given a little bit more on that definition, but
I looked all through the whole thing, and that's the only definition I saw was variable of interest. I'm like,
yeah, that
Okay,
was
what's
the only one.
interest?
So
But that's confusing too, because you could say, is it the people, this and that, but no, it's the sleep. They're trying to figure out in the end, that's whatever they're giving
Yeah.
them the medicine for is
Oh.
whatever the variable of interest is.
yes,
Does that make sense?
yeah, that makes more
Okay.
sense.
Mhm.
so the next one is treatment.
It'd be
So would
that
that be half the
medicine.
subjects?
Yeah,
What's
the
that?
treatment would just be
Well, the treatment would be what they're giving them.
Yeah,
so
sleepy
the
or
sleepy.
placebo.
Oh, because see, I got the group that receives the experiment or the procedure.
That would be the
Treatment
the
group.
subject. The subjects would be the ones that are participating.
Yeah.
Okay, so but I thought treatment. I thought
So,
treatment was the ones that actually got the actual, not the placebo, not the one that just was
Well,
observed
I
doing
guess
nothing.
that's still part of the treatment because to the patient, they still think they are being treated.
Yeah.
So then we have to say the sleepies or the placebo.
Exactly.
Yeah.
And that's
So
what it says in the answer key.
Okay.
Yeah, so the treatment is both the medicine.
medicine.
The
Both of them.
placebo and the sleepies.
Yeah.
has
So
to be
it's
both.
basically
Okay, that makes
anything you're using or doing to get the response you're looking for.
Okay.
And then the subjects, I
That'd be
think
the people.
that's patients. So
Yeah,
1,000.
the 1,000
1,000
people.
insomnia patients.
Yep.
Okay.
Perfect. And then, so last question. In September 2004, Newcrest Pharmaceuticals, Inc. announced the results of its first human trial of NPI 32101, a topical form of its skin ointment. A total of 224 patients diagnosed with skin irritations were randomly divided into 3 groups as part of a double-blind, placebo-controlled study to test the effectiveness of the new topical cream. The first group received a 0.5% cream. The second group received a 1% cream, and the third group received a placebo. Groups were treated twice daily for a 6-week period, and the degree of skin irritation was recorded at that time.
If I get a treat, what do you want?
So what kind of treatment? So we have an observational study or designed experiment. So
Obviously designed.
yeah, this would be
Yeah.
a designed experiment because you're involved in it basically.
And it's, yeah, you have to
You're doing
follow
it.
up with it, really.
Yeah, you're doing a treatment. Whenever there's a treatment, it's designed.
Yep.
Otherwise, the other one you're just completely observing.
Exactly. So then it says, what are the subjects? So the subjects,
Those would be the people, the
the
224.
224.
224 patients with skin irritations.
That's pretty easy. Yeah.
And then what is the response variable in the experiment? So what are they looking? So it's something to do with
The degree of skin irritation, is that what it is?
Yeah, so like you're trying to see like how much the skin's being irritated.
Okay.
Yeah, study to test the effectiveness of the. Oh, sorry, hold on. Where did it go?
And then
Yeah, I'm looking for skin irritation. So
Okay.
Yeah, the last line it says the degree they're gonna test the degree of skin irritation was recorded at that time.
yeah. Okay, and then the treatments would be the creams,
Ointment.
varying.
So yeah, third placebo, the
Yeah.
third 0.5,
and
the
I
third
think
1%.
we always have to remember the placebo. It looks like because I would just be
Yeah.
like, oh yeah, the creams, but I guess when we answer, we always have to make sure we put in the placebo if there's ever a
Yeah.
placebo.
Well, because that's the control for them
Yeah.
to compare against.
Yeah.
So yeah, you would have to.
Yeah.
Oh gosh. Okay, so it's the placebo and the cream.
hmm
And did
there's
someone
two
say one
there's
other?
2 different types of creams.
Right.
Two
There's
different- There's
multiple.
a 5, a 0.5 and a 1%. 0.5% and a 1%.
1.5%. And the 1. Okay, so let's see. So on the answer key, it was a designed experiment. The subjects are the 224 patients diagnosed with skin irritation. The response variable is the degree of skin irritation observed in the patients. And finally, the treatments are both the 2 types of cream and the placebo.
Okay.
Correct.
We were definitely on track.
Cool. It's not as
Yeah.
scary as I thought.
It's not too bad. So now that we have that completed is when we would do the online quiz.
Yeah, do we have to turn this assignment in or no?
Uh,
I can't remember.
Good question. Are we
Right.
supposed to save a link to this or something, or what? How
Yeah.
does this all?
There's a place
need
to
the link
post
to-
the video.
yeah. Well,
Okay.
I think as we're doing it now, it's already recording because it's on air for people to
Correct.
view later.
But we have to
So-
post the link still when we're done.
Oh, yeah, exactly.
Because I guarantee no one is watching us.
No.
Probably not. Let's hope not.
Nope.
Big brother.
No.
Yeah.
Well, except maybe the teacher, if they do a random check. Because I know that they're not checking every single time.
Yeah,
Yeah.
They're
he just said that you
Random.
posted on there, and he's going to check a few of the links just randomly.
Right. To see that we're doing it. And to see, I guess, where we're at. Okay, so in terms
So
of
we post
actually
the link
putting-
like in a discussion later. Is that what we do?
Yeah, it looked like you would post it in the group collaboration discussion board.
Okay.
LO2 group collaboration discussion
I
board. It
see that.
says, let's see, post a link from your Google Hangout group meeting to this discussion board. So if you guys want, I don't know how it works, but since I started the call, I don't know. Anyways, I'll try to post it, and that means it's, and then I don't know, or do I give you the link? I'm not sure if it, because he said that this group collaboration is supposed to be just for our group, but it doesn't look like it is. So
No, I think we each in the whole entire class have to each post our, but
Okay.
do you post it for all 4 of us and then we're good, or do we all have to
each
post
have to
it
do
showing that
our
we were
own
there?
thing.
I'm sorry?
I think we all have to do our, like, the group meeting assignment, and then I think since it's going to be saved on Carrie, it's going to be saved on your homepage or whatever since you did this. And so I don't know if we have to submit that or if they, since he's part of your friend or whatever, right?
So what I'll do, just so that we can cover our bases, is that when this call is over, I will make sure I email you all the link. That way, if we are required to individually post it, you will have the link. And if not, I will post it on that discussion board for sure in behalf of our group. But I will make sure you all have the link so that if you do need to post it, you have it.
I think what we need to do is, Carrie, if you can post in the discussion board, and then we all comment on that post and say, thank you, I attended the video. Yeah. I don't think we all need to individually post it, but as long as we all comment on that.
Yeah.
Yeah, just so you have it, just in case that comes up, I'll do that, but I'll post it.
Thank you. Yeah, and then we'll just comment on your post.
Okay.
Okay, cool.
Are we starting the quiz?
I believe so.
I'm like, do I push start?
Ugh, I hate doing the initial, pressing start.
Don't push.
Wait, so which one are we doing? The group meeting? Is that what we're doing?
And we're in the homework.
Under homework.
What about the group meeting one? Were we just doing that one?
I think group collaboration is just where you post it. And then do we have to meet in group meeting on Thursday? Is that what that is?
So the group meeting is what we're doing right now.
Yeah.
And we just worked through the problems. And so maybe when you push start,
you have to post the link?
It says, after you've completed the group assignment, click start below to begin the group preparation quiz. While you're encouraged to, so that's what we need to be, let's start there first.
Right.
So go on to LO2 group meeting.
This is so just all over the place.
It'll just be this way the first time. I think we'll figure it out, but this is a new class.
We'll have to do it twice a week, so woo.
We will have to do this twice a week, right?
Twice a week.
Yeah, twice a week. So do it again before Saturday.
Yeah. Not that you guys aren't nice people.
I know.
But
you're all very lovely, but
all right, that's why we got to do this as fast as we can. That's why we got to be quick, because we all have lives. So
yes. All right. So
are we supposed to do this for an hour or no? Just get it done.
It says 20 to 40 minutes.
Okay.
I believe.
I never saw a time amount. I just get it done, I think. So
okay. So we leave
at roughly
later,
30, 40
and
minutes.
the homework quiz is on our own, correct?
I don't know. Let's go to the group meeting and push start and see what it has on there.
Well, real quick before we do the group, I guess we could do that. We'll do
Let's
one
start
thing
with the first group meeting, LO2 group meeting.
LO2 group meeting, start. I'm pushing start. Let's see.
Okay.
I just pressed start, so let's get this done. Oh my
So
god,
after you
17 questions.
start to begin the preparation quiz. Well, encouraged to work together in this quiz. Each member of the group must submit their own answers. Okay.
Yes.
So here we go. Do you want to start? I'm starting now, folks.
Yep.
Did it.
Okay, I completed it.
Is this I completed the individual preparation assignment before attending?
Yep.
Okay,
It may just
True,
be that.
True.
Okay.
So now the third question is where it actually
There we go. Yeah. Researchers. Oh, go ahead. Sorry, you're leading it.
Oh, I don't know if you wanted to read it. Sure. So 3. Researchers would like to determine if reviewing material consistently within an hour after class helps students perform better on exams than if students wait to review material the day before the exam. To answer this question, the researchers are trying to determine if an observational study or an experiment would be more appropriate. They're discussing who the population would be and how they will determine which sampling method will best represent the population. Which of the 5 steps of the statistical process are the researchers currently applying?
Okay.
Design a
so-
study.
Yeah, I would
Yeah.
say,
Design the study.
yeah.
Yeah, we're trying to figure out what to do. Yeah.
So design the study. That is what we're choosing.
Okay,
Nice.
number 4.
Number 4, a researcher has collected the results of a survey where the participants were asked how many hours of TV they watched each day. The researcher tallies the frequencies for each category and computes mean number of hours watched. She then creates a histogram to help illustrate the overall distribution. Which of the 5 steps of the statistical process did the researcher apply?
Would that be describe the data?
Yeah,
Well,
she made
I
the
think you-
histogram.
Because she already
I
tallies
would
the
have said
frequencies.
don't collect the data, but then she made a graph of it, so she
Yeah.
it kind
So
of
I'd say describing.
I would say
If you can't
describe.
choose 2, it's going to have to be described because the histogram was the last thing she did.
Yeah.
it just
If
kind of
she
confused
didn't
me
do
when
that,
they put
then I
both
would
those
say
together.
Yeah.
What's that?
Yeah. That works.
Yeah, I
So-
mean,
So we're going with describe the data?
yeah, that was
answer?
kind of a tricky one because it added both, in my opinion.
It did.
Yeah.
The researcher tallies the frequencies of each category and computes mean number of hours watched. She then creates a
Collecting all the
histogram.
data right there.
So
But
yeah,
she
I think
collected- they moved on to the describe. So I think that's,
exactly. So we'll
Okay.
stick with that. Okay.
Okay.
So number 5. Mumbai, India is a quickly growing city of importance in its own country as well as the global economy. A marketing research firm has been asked by a prominent fast food restaurant to help determine if the citizens of Mumbai would support this fast food business. From a list of all registered taxpayers, 3,000 names are randomly selected. Each individual on the list is mailed a brief questionnaire. The researchers receive 1,049 responses. The population is the 3,000 people who are mailed the questionnaire, the 1,049 people who respond, the citizens of Mumbai, or cannot be determined. Oh gosh.
I think
Okay,
it's the 3,000. No, hold on.
3,000 names are randomly selected. Yeah, I think so. Well, because then it says each person is mailed the questionnaire, so it's still the same thing.
So, but remember when they're doing this, they kind of
They're
generalize
trying to represent
what
the
the
general.
population is. So would it be the citizens of Mumbai?
Okay, let's see. Because I know they're trying, yeah, like you said, they're trying to take a sample to represent the general population.
Right.
Yeah.
But in a study,
isn't.
the population, the subjects are the ones who respond,
Exactly.
right? I mean, the
But
subjects
it's
are
not
the
saying
ones.
who the subjects are. It's
Asking
asking
who the
who
population, but is that the
Yeah, so it must be the
citizens of
I
Mumbai?
would say the citizens of Mumbai.
Yeah.
Oh
Yeah, 'cause
gosh.
I think they would use the word subjects if it was the 1049. You know what I
Right.
mean?
Yeah, good
Yeah.
call.
True.
So let's try the citizens. I don't know. It could be cannot be determined, but I don't know.
Well, oh gosh, this makes me nervous. I hate
Hooray!
this.
It's okay.
Okay, 6. Mumbai, India is a quickly growing city. Oh wait, I did. Oh, it's the same one. Okay, sorry. Wait, no, it's a different
No,
one.
it's a new question, just saying,
Oh.
but they're going to ask something else. The sample is.
India is a quickly growing city.
So it's
of
the same question, it just asks a different answer. It says the sample is.
Oh, you're right. I was like, wait, that's the same question. Okay, so the sample.
Oh,
So is that the 3,000?
it's got to be the 1049.
So wait, but oh, I guess if that's all they got back.
Yeah, then that's what would be a sample would be.
Okay. Because if they had the 3,000 names and 3,000 people responded, then that would. Okay. So
Yeah.
then what in all of this is the 3,000?
Nothing.
Just curious.
Nothing.
So
That's
the
the
Nothing.
sample is the 1049?
Right. Because those are the
Response,
ones who
correct?
actually gave the information back.
Okay.
'Cause that's all
3,000
they
is
can go
nothing.
off
It's
of.
just 3,000 are part of the random numbers they selected, but they're not
Oh.
part of the. They are not part of the actual
Okay.
observational study because they did not respond.
So the sample would be whoever responds, correct?
Yeah.
I think.
Okay, that's how I feel. Okay.
All right, number 7. Studies have shown that retention of classroom materials can drop as low as 58% within 15 minutes of class and within 44% after the first hour after class. This forgetting curve continues so that within 6 days, only 25% is remembered. How can a student conquer this forgetting curve? The researchers in this study claim that constant review is important. Suppose your teacher wanted to test this and invited you to participate in a study where you are asked to review specific material 15 minutes after class for 10 minutes, an hour after class for 10 minutes, and then again 2 days after class for 10 minutes. Your teacher then gives you a short 10-question quiz where your score out of 10 is recorded. What type of data is your teacher collecting?
Quantitative.
Quantitative.
Yeah.
Because it's trying to figure out the number.
Exactly.
Yeah.
Okay. 8. Studies have shown, oh, it's the same thing. Oh.
Okay, so it says after the 6th day, your teacher
Yeah.
asks if you feel confident you have retained at least 50%.
You better-
Category.
That would be categorical because it's not a number that can be changed or multiplied or divided.
Right.
Yeah,
If you
he's not
add it
checking
or
the
any
number.
of
He's
that.
just asking if you, yeah.
How you felt.
Yeah. Okay. So number 9. Studies have shown that retention of classroom materials can drop. Okay.
Oh,
So
all right.
let's go to the bottom. Your teacher also selects a group to give no review to the material over the 6 days. This group is called the control group.
Control.
Yeah.
Yep. Okay. Man, I
Or-
hate it when they give you that same question. I'm like, wait a
I know,
minute.
it confuses me.
Okay. So yeah, I think it's the control group just because that's what they're going to be comparing it against.
Yeah.
And they're
It's not the
giving
null,
us-
but yeah, they don't. It could also be null, but that's not on there, right?
No.
Yeah.
So, and the people getting the treatment are the other group because they're the ones being told to study, this amount of time, yada,
They
yada.
would be the hypothesis group.
Right.
So, yeah.
That's what I meant. Okay. So, 10, which of the following would be considered an experimental design? Telephone poll asking people about whether or not they vaccinate their children.
No.
Administering the tuberculosis vaccination to one group and giving a placebo to another.
That one.
That
Yep.
one.
Yep, and then it's like a mailed survey and consensus. Okay. In a study to determine the average wage of working people in Mumbai, which of the following would be the best sample? Oh, it's average wage
I
of
would think the third one.
many randomly selected workers in each of several working districts.
I
That
agree
way
with
you-
you.
That
Because
way
it
it's
would
like
be the.
random
'Cause
people.
yeah. You got to cover the whole city, not just one district, because one district might make more money than the other person.
Yep.
Hold
Right.
on, but is it the working district of somebody? Okay, hold on. Sorry, I want to.
Or could you, well, I guess you'd be limited. I was thinking the first one.
Average wage of working people.
Yeah, working people. So you have the different districts.
But
You
what
want
about
to
number 2? All workers in working district of Mumbai.
In one working district,
One
but we don't
yeah.
want just one.
Oh, I'm sorry, I didn't see
Not all
1. Yes. Okay, so I see 3. Yes.
Okay.
Okay, so we'll go with many randomly selected.
Yeah.
Okay. 12. You want to become the next Jonas Salk and produce a vaccine that will help cure children of respiratory syncytial.
Whatever. RSV.
You test the vaccine and compare it to a placebo and randomly choose one group of children to take the vaccine and one group to take the placebo. What or who are the experimental units or subject?
The children.
Yeah.
Children.
Okay. 13. You want to become the next. Okay, looks like the same thing.
The treatments would be the vaccine and placebo.
And placebo.
Mhm.
Yeah.
Okay, 14. In 1992, the U.S. government supported a study that was run for 15 years where 4,608 low-income families were given a chance to move to less impoverished areas. They distributed vouchers and provided various support systems. The researchers wanted to determine if getting people out of poor neighborhoods would reduce the poverty level of U.S. citizens. So what is this? The low-income families were randomly assigned to one of the following three groups. 1, the MTO low poverty voucher group, which received Section 8 certificates or vouchers usable only in low poverty areas with less than 10% of the population below the poverty line in 1990, along with counseling and assistance in finding a private unit to lease. 2, the traditional voucher group, which received regular Section 8 certificates or vouchers and ordinary briefing and assistance from the PHAs, so local public housing authorities. Or 3, the control group, which received no certificates or vouchers but remained eligible for public or project-based housing and other social programs to which families would otherwise have been entitled. This study was a observational experiment or neither.
Experimental one.
Experiment.
Well, what did they experiment on?
Yeah.
I think it's just
I don't know, I think
observing
it
what
might
happened.
be.
Oh, because they gave them different things. That's why it has to be an experiment.
So
They're
you're
checking
saying,
to
is it an experiment or
No.
neither? Like, what's the outcome? Is that what you're wanting?
Well, I think,
Oh,
because the
they're
experiment.
experimenting if it will reduce the poverty level. So they're
Yeah.
experimenting if they're
Oh,
given these vouchers,
True.
will it reduce the poverty level?
Which one
Yeah.
would they do better getting out of poverty on? And it is, anytime they are assigning people to a group and selecting a number of people to give them the opportunity or to do it, that's an experiment instead of an observation.
So I guess in the observation, you would come up with what you're looking to find, and then you just leave it alone and watch and see what happens?
Yeah.
Okay.
I don't think you don't have a hypothesis or null hypothesis in an observational study, only in experimental.
Yeah.
Okay, so no, this and that. Okay. All right, 15. If a p-value of 0.002 or 0002 was found for the study described above, then we could say that there is about a 0.0002 probability of obtaining the actual observed result, or one more extreme, assuming the null is true. So the
Yeah,
null they said is
This
like
is my
the
question right here.
Yeah, yeah, you called it.
Yeah.
So I guess the null is, what they would assume would or what am I trying to say?
So the null is a status quo.
Yeah, exactly.
Um,
It's the expected, I guess, or the usual.
the usual. And so by doing something different, giving them those vouchers, your hypothesis is that something would change.
Right.
And so, but these numbers is what's getting me. So
if a p-value of 0.0002 is found, there is a point in probability of obtaining the actual observed result, or one more extreme, assuming the null is true.
yeah, that question makes no sense to me. So
I don't know.
Confusing.
I kind of want to say false, but I don't know.
yeah, because this is what the deal is.
0.002 is
That's a
so
very
little.
low. So they say the lower the number, this is all I do know.
Exactly.
The lower the number, like he said, say for instance less than 0.05, then you would say you reject the null. So that's a very low, this probability is very low. I don't think, and so if it's a low probability, we reject the null. So what does this question even ask me? I can't figure it out though. Or
Is it saying if the
These are
p-value?
what I struggle on.
so
the
wait, what were you
p-value-
saying?
Me?
Yeah, you. Sorry, what's your
Sorry.
name?
No, Jared. Yeah, you're good.
Jared,
I was saying
okay.
because it says the p-value that we found was 0.002, and so we would say that p-value. I don't even know.
Putting
As I
into
said it, I
question.
forgot. Yeah, I don't even get it. So.
So I guess it's telling you. See, it's like you kind of have an idea in your head of what they're saying, but it's not a well enough formulated idea in our minds that we can verbally express what it is. So we're all like dancing around it, but
I think
I
it's
don't know.
false, but I don't
Let's
know.
jump to 16.
All
Yeah, I'm
right.
just going to put my own answer there. I don't know. I'm going to say false, but whatever.
Okay, so if we
Let's go
put,
to 16 and see if that
Yeah.
helps shine some light.
let's
Yeah.
do that. Let's do that. Okay, 16. Since the p-value is low in question 15, the researchers could conclude that the results are significant, and providing low-income families with an opportunity to move away from low-income neighbors does make a difference in poverty levels.
Now
True.
that one is true
Yeah.
Yes.
because if it's a low p-value, you reject the null and you go with your hypothesis.
Right.
So
So what does that tell us about the question 15?
I still don't even understand what they're even asking in question 15. I can't understand. Like the wording is kind of unclear to me. But
I guess
Okay, if the p-value is found in study described above, we can
I
say
feel
that
like
there is about a probability of attaining an actual observed result. So, assuming the null is true. So would that be true or false? Hold on.
I'm trying to find
if
it.
anyone can figure out what it's actually asking and in real English, that would help.
Yeah, right.
Well, if it must be, is it opposite of what 16 is? If 16 is true, wouldn't that be false?
I put false because the low probability. Just a second, sorry. Of obtaining the actual observed result. The actual observed result was whatever they observed and they never told us. Or now this or
extreme, assuming the null is true.
What
I
is
would say
or? What does the phrase "or one more extreme" mean?
Yeah, I don't know that part. I'm just going back to the reading and rereading what the p-value is.
Right.
So it's large.
I think it's the probability that the results are just by chance or by error. So that's why if it's a really low number,
I think it's calculating the amount of error in.
well, like
That is not what.
if that number is really low, that means that the results you saw weren't just like by chance. That there was a big enough difference between what happened for it to be significant enough to accept.
So then the p-value, what that is it's measuring the amount of error within the status quo or within just the experiment in contrast to the status quo.
I say we move forward.
Yeah, I think we'll figure it out.
I'm
If I
just
get one
gonna
wrong,
put
I don't
false.
care.
I'm putting false. So
Okay, but
is super easy. Is this the last part we have? I'm so sorry because I have to leave in a minute.
no, you're
Yeah.
fine. We just literally the last question is matching up the 5 steps. So collecting data is D. Taking action is step 5, so that's A. Designing the oh wait,
I have
no,
collect data as C.
that is
Yeah.
Sorry, I didn't mean to
So
say
I
that.
had C, A, D, E, B as in boy.
Exactly.
Take action.
And I'm going to submit mine just to let you guys know, and I'll see if that false was false. How's that?
Perfect.
No,
I got a 94, so let's see.
So what was?
Let me go down. So it must have been true.
But I wonder why.
No. Or yes, it's false.
So
Hold
That's
on.
what
I forgot to mark it.
oh
No, I marked it
no.
false. I marked it false, and it's true.
Oh,
So whatever it is, I'm like, wait, I didn't mark it, but no, I marked it. It's true.
number 15 is true.
Mm-hmm.
Okay,
Go
I'm going to
figure.
show this one to my husband. I'm going to have him explain that to me because he'll be able to understand it. Okay.
Okay.
So what were they for 17? Sorry.
17. Oh,
I'm walking because I need to go plug this in now because my computer's going to die too now.
So CAD, and then I am doing the last 2. So gosh. Step 1. Hold on.
Hi, babes. I'm still in my class. 1 second. My power is just going to die in this.
Okay, let's see.
Well, step 1 would be number 5, so 5 would be B.
Making an inference?
Wait, isn't the first thing to
No,
do is design the study?
Yeah, sorry, I was confused.
Yeah.
Sorry.
Making an inference is step 4.
Okay, so 5 would be A. Step
B.
1, B.
So it should be, I think, CADEB, right?
Wait, isn't take action the last step?
Yeah, step
Yes.
5.
Okay.
Yeah.
Step 5. Oh, yeah, C.
Yeah. So
So collect the data. That's step what?
2.
that is step 2.
So, okay. You take action is step 5. Design the study would be step 1.
Uh-huh.
Yep.
Describe the data would be step
3.
3. Okay. And
Yeah.
then step 4, make interface.
Yeah.
Make inferences. That is step 4.
Yeah. So it's CADEB, right?
No, that's not what I have.
The numbers are different. The letters are, but
Oh, for each person. Yeah.
Oh, is it?
Yeah.
Okay.
Cool.
Where do I... What is going on?
Okay. Is this the last thing we have to do, or is there another quiz? This is the quiz, right?
Yeah, I think that's done, and now we have the homework quiz and assignment where you can use other help with it. But
So do we just do that on our own then after this meeting?
yeah, and I'd say what we do is, like, since it's not due till Saturday, you can save it as you're doing it. And so I say if we have questions, we can email each other. I
Okay.
think.
Hold on. Oh, gosh.
Okay, so you're saying that we don't need to start LO2 homework assignment and quiz yet. Start it on your own and then ask each other questions.
Yeah. It says,
Okay.
yeah, you may use your notes, but you should complete the quiz without help. Oh, sorry. Yeah, without help from others. So it's individual.
Yeah,
Individual.
it is individual.
Yeah.
Okay, so then
Okay.
we do one quiz together, one quiz by ourselves, and then just while we have each other, when do we want to meet for the lesson 3?
So we have to meet on Thursday. Let's meet Thursday. Does that work?
I think so. I mean, so as of right now, I'm still working on figuring out my other groups and when we're meeting and
Yeah,
yada,
me
yada,
too.
yada. But as of this week, maybe I can do Thursday. I mean, I'll definitely check into it tonight or tomorrow and let you guys know. But Thursday should be fine. I get off work at 6
Are you
Eastern time.
Is that every day?
Most days except Wednesday.
Does this meeting have to be Thursday? Okay, so you would never be able to do during the day.
Nope. I mean, not because I am a hairdresser, and so it really just depends on my schedule that day. So literally the only way I could tell you for sure was the day of, if I
Yeah.
looked at my schedule. And even then, I'd have to ask for permission to block out time. And so it's just, I don't know. It's, yeah. I wish I could.
Well, I say we just shoot for Thursday. 6 Eastern time is 4 my time. Mountain time.
Yeah,
Okay.
I can't do 3 p.m. So it
What
would need
about-
to be during the day or after. I mean, 4 p.m. is a stretch, but I can do it. I have 6 kids. I have to pick them up from school and things at 3. So
We
Yeah.
want to do like same
And
time we
could
did
do
last. Like,
7.
what about today? Like 5 p.m. Mountain time. Like we
yeah,
did
I
today.
can swing the time we did today on Thursday. Can we just plan on that?
Yeah.
That works with me.
Okay, Thursday 4 p.m. and I will let Sarah know that. Hopefully she can do that. Is it
Okay,
Sarah?
cool.
That would be awesome. Okay, so then you're going to send us the link for this, and then I
Yeah,
guess.
I will post it and I will send you the link as well.
Okay,
Awesome.
perfect. All right, well,
Thank you.
yeah, thank you guys. It's pretty
Thank
good.
you.
Do
See
we
ya.
know who's going to be the leader for the next one?
Jared, do you want to be the leader for the next one?
Yeah, I can do it.
I mean, there's
Alrighty.
so
Yeah.
perfect. All right. Well, nice meeting you guys, and I guess I'll see you in a day or two.
Sounds good.
Yep.
All right.
Bye.
Bye.